Yeah, I was scaring myself for nothing.
You definitely were.
Is it bleeding?
A little bit, not a lot. Very tiny. And you were all done.
I'm done?
You're all done.
Yeah.
So his experience was different than mine. So when I got my PRP injections, I did feel pain, and the reason why I believe is that not as much anesthetics was used. Another thing that's interesting is he's having a nurse do the PRPs, where for me, I actually had my dad, the doctor, do the injections. And if you do come into Coast Spinal Sports Medicine, you're going to have an orthopedic surgeon doing it, not a nurse. And it's just funny because if you are going to pay the high price of PRP, because I know there's areas where they're charging like $1,000 a shot, make sure you have a professional doctor doing it. If it's going to be a PA or a nurse, hopefully you're paying under $400 or $500 because that's very, very pricey. And I recommend to anyone who's following this channel, like I said, you could come and we do our injections. We have a really good deal. We offer $400 injections, but it's by a doctor, not a nurse. And you can price shop, and I'm sure you can get a better deal. Like I said, you know, if you don't live in California, you don't want to fly to California, there's going to be areas where you can do your PRP injections, and it's not going to be, like I said, hopefully you're not paying $1,000, because I have some friends in New York that were paying $1,000 for their PRP injections, which I think is really high. And then also, so yeah, there's not much bleeding, but there is some pain. And for me, I've never gotten a tattoo, but the experience is kind of like the tattoo. So I felt it. If they use really strong anesthetics, then maybe you won't feel anything. But for sure on the hairline, I know that this guy wasn't feeling any pain. But I, myself, every time I've gone in, I actually asked for my second PRP injection for more anesthetic. And yes, it was less painful, but you still feel it. So just realize that there's going to be some discomfort, and if you're not okay with that, just make it clear to the doctor or the nurse that you want extra anesthesia, you want it extra numb, you know, whatever they can do to make it less painful, because I didn't feel any pain for my elbow injections, but I for sure when I get my forehead for the hair loss, there is some discomfort, and I would go in with the expectation that you're going to feel a little bit of pain, but like I said, if it's something you don't like, definitely make it a point to your doctor that they use extra anesthesia. They give you extra ways to manage the pain. But let me know your thoughts on this, and I will talk to you guys soon.